Violence against staff in the NHS is increasing. This problem is something that cannot be tolerated. It was national news in England last week. We all deserve to feel safe and supported in our working environments. And our hard-working staff should absolutely not have to feel fear and apprehension about attending work. This is not a privilege, it's a fundamental right in every workplace. I'm sure that many of you would have seen the recent results of the NHS staff survey. And while overall there were some great improvements, the results did raise increasing concern about violence against our staff. That's why it's with mixed emotion today that I speak to you about this important agreement. The role of the criminal justice system is rightly limited by the fact that the violence is often unintentional or a consequence of a clinically related condition. However, there remains an increase in intentional violence, and that is simply wrong. In Wales, we have comprehensively revised our existing measures to facilitate the essential joint work between the police, the National Health Service and the Crown Prosecution Service where our staff have been assaulted. In December last year, we invited all NHS leads for violence and aggression, all 4 police forces and commissioners in Wales, the district Crown prosecutors and the head of the CPS in Wales to a national launch for the revision of our arrangements, along with support from the Royal College of Nursing, the College of Policing, the British Medical Association, Unison, GMB and other staff side organisations. A working group now known as the Anti-Violence Collaborative has met monthly across Wales to develop an agreement, and I'm delighted to say it is now at the final draft stage. So I would like to take this opportunity to thank the Anti-Violence Collaborative for their immense effort to reach this agreement, which will be launched on the 21st of November in Llandrindod, Wales. I was really happy to see a recent tweet from my old colleague Darren Dupre of Unison, and that read, "There is a real sense that NHS staff are now front and centre of the new agreement." And that is absolutely true, absolutely what we want to do. NHS victims are expressed as being central to the agreement, and in addition to the name, Obligatory Responses to Violence in Healthcare has been deliberately adopted to confirm the intent of this agreement and to make it clear to the signatories that they're obliged to implement its provisions without exception. Let me take a moment to tell you a little more about the agreement. There is clear acknowledgement that the National Health Service has the first responsibility to identify and respond to violent incidents, and in turn to prevent them using refined risk management techniques. And these are distilled from the ongoing experience of dealing with these cases. The term capacity has been removed and replaced with intention to commit a crime. We anticipate that this will help to make it simpler for police officers to move a case forward for a possible charge and where appropriate and mitigate against unnecessary miscarriages of justice. The agreement itself places emphasis upon the proactive role of the National Health Service case manager and the importance of that role to the success of the agreement in encouraging and enabling continuity for staff during an undoubtedly distressing time. A simplified process map has been developed, and this will allow easier access to the aims of the agreement at a glance and smartphone applications for the use of both police officers and NHS staff will be developed to help them to understand the process in full from their own phones. The agreement has been updated in terms of criminal procedure and sentencing legislation, including references to the Assaults Against Emergency Workers Act 2018, which increases the penalties available to the courts. It recognises the aggravating features of such assaults and has been shortened to make it digestible, with operational guidance and fully revised appendices available only in electronic format which is hosted by NHS Wales Shared Services Partnership. There is a recognition of the need for publicity in implementation and ongoing proactive review, and the Anti-Violence Collaborative will continue to meet post-launch to receive reports from all parties, and in turn will comprehensively report to the Welsh Government every 6 months on prosecutions and assaults that have been captured and actioned. This agreement also recognises what I said at the outset, and what all of us in this room know to be true, that staff should feel safe and secure in their working environment. That is no less true in our National Health Service to any other workplace. To ensure that this is the case in our National Health Service, incident and reporting needs far more encouragement and an assurance that such reports are reviewed and analysed by NHS Wales, to persuade NHS staff that reporting violent incidents is worthwhile and that violence is not accepted as part of doing your job. That is why, in order to support the implementation of this agreement, the Collaborative has developed a comprehensive new range of posters which have been printed. Now, these will be made widely available for the launch, and I hope to see these proudly displayed across all of our organisations in the very near future.